inflation, according to the Ontario Hospital Association, who say that they're actually facing a deficit this year of $360 million. They're saying they're facing more financial pressures this year, despite the provincial government announcing up to $1.1 billion for them in the spring budget. At this point, the organization says hospitals are still facing cost pressures of $1 billion at this point, an increased demand for services, more complex care needs for patients. People are living longer with more chronic diseases, and the rising rates of illnesses across all age groups, so that much more pressure for the hospitals. The OHA claims that, yes, they're managing admissions and shortening lengths of stay to help with those costs, but that can only go so far.
The purposes of this year, we really need to maintain stability. Hospitals have done an excellent job at continuing to look for efficiencies and to streamline operations. But we're at a point now where, in addition to creating that stability for the short term, we need to be thinking about what our longer term opportunities are to create a system that's going to be sustainable for the future needs of Ontarians.
For the last 3 years, we have given hospitals across Ontario an average of 4% increase. That's 3 years running we have done this, and now we need to work directly with all of those hospital corporations and their boards to make sure that we have, and they have, a plan to balance so that we all understand where the challenges are and where the opportunities are, and we'll continue to do that work.
Despite those increases that the health minister has said have come from the provincial government, obviously the Hospital Association says it's still not enough. No indication from Jones at this point that any sort of movement will take place as part of the fall economic statement expected sometime soon.